All right, we're going to move on with our program today. We're going to welcome Claude Burfect of the Seattle-King County NAACP and the Coalition of Black Trade Unionists. Thank you so much, Claude. Come on up. Claude has also done amazing work on the Healthcare as a Human Rights Steering Committee.
Okay, I was given a short time to speak today because the last time I spoke at the federal building, oh boy, I went a long time. But anyway, I just we want to talk today about universal health care. But one of the things I want to look at first and foremost is America. We are a resurrection and not an insurrection. Did you know that poverty is the fourth leading cause of death in the greatest country in the world? Hundreds of thousands of people die every year from poverty and inequality in the United States. Poverty is a major cause of ill health and a barrier to access and health care when needed. Unfortunately, this relationship is financial. The poor cannot afford to purchase things that are needed for good health, including just 1 second, I shouldn't have done it this way. But sufficient quantities of quality food and health care. When we also look at the barriers to health care for low-income people, we also have to consider why does the United States have poor health outcomes. It's apparent that we look at social and economic conditions, which is impactful and matters greatly to health and affects a large segment of America's population. Despite America's large and powerful economy, this country has the highest rate of poverty, income inequality than most high-income countries, which is why Donald Trump couldn't get folks to come from Europe here. Also, when we look at consequences of poor access to health care, we must consider the lack of health insurance coverage, period. Uninsured adults are less likely to receive preventative services for chronic conditions such as diabetes, cancer, and cardiovascular disease. Universal health care is not only necessary in the state of Washington, but the country. I'm going to give you an example. My wife's nephew has prostate cancer. In order for him to live, he has to take Xtandi, a medication that costs $46,000 a year. He has to get grants to pay for his medication. His insurance will not pay for this medication, which is another reason why we need universal health care. All in all, we need universal health care in this country because not only are poor dying, but seniors are dying because they cannot afford health care as well. Lastly, and I want to make a statement on this one here because I think it's important that we know what's going on in the state of Washington. And the statement that I want to make is that our state legislators and congressional leaders on board, we need to make sure that they're on board with universal health care. But here is a statement that I really, really want to make that I think you guys will think about this. Did you know that the state of Washington is one of the top states in America with a large number of billionaires? Also, did you know that the net worth combined of the billionaires in the state of Washington is $401 billion? And guess what? They are not paying their fair share of taxes in this state. Because if they were, we would not have the problem of poverty, homelessness, and health care. We also must make sure that our state legislators put together legislation that impose significant taxes on these billionaires that will help solve some of Washington state problems. And what I like to say is forward together, not one step back. Thank you.
Let's hear it one more time for Claude. That man's been fighting for justice since before I was even thought of.